The 16th branch of Megamart and Macromart supermarkets in Bahrain has opened in Sahala. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. Megamart and Macromart, your favorite shopping destination.
NEC Remit. Send money online to India. Credit in seconds with great rates. Download NEC Remit app now.
The exclusive franchisee of Cochin Kala Bhavan in Bahrain. With over a decade of existence in Bahrain, exclusive online regular classes have started for classical dances, music vocal, instrumental music, cinematic dance, Kathak, Zumba body fitness, karate and yoga, drawing, arts and craft, children's theatre. For more information, please call 3909 6845 3909 4806 3885 2397 or visit www.bahrainmediacity.com. Since 2006, Magnum Imprint have been offering high standards of quality with our professional team that delivers all your advertising and promotional requirements efficiently and promptly. For more details, please contact 39887088 or 33856330 or 33542530.
Good evening, friends. Welcome to a brand new episode of BMC Global Live Hilal Health World. Nothing but lifestyle. A healthy skin is an indicator of your overall well-being. Glowing and radiant skin is something we all aspire for. And as you all know, summer is at its peak. And this is a time that we need to take extra care of our skin to maintain its glow and its radiance. Today, we have with us Dr Sithara Sreedharan, specialist dermatologist and cosmetologist from Al Hilal Hospital, Muharraq. She has over 10 years of experience in the field of dermatology, and she's an expert in treating acne scars, Botox fillers, and dermatosurgery. Thank you so much for joining us on the show, Doctor. Pleasure to have you with us.
Thank you.
Today,
Thanks for this opportunity.
Thank you. Doctor, can we begin by broadly classifying what are the effects of harsh summer on the skin in a general sense?
Yeah. So, skin being the most external of all the human organs, it is obviously under the influence of various factors which can be like naturally existing environmental factors or man-made human pollutants or even other coexisting organisms like other plants, animals, everything can have an influence. And of these, sun, which is ubiquitous, which is always present, is having a lot of beneficial effects. At the same time, a few things of concern as well. So, we should be aware of these factors, especially those who are inhibiting this tropical as well as arid regions where the summer is really harsh, intense, with very high temperature, humidity, etc. Since it's having various effects on the skin. Okay, so It is seen that we can broadly classify the effects of summer on the skin into two. That is, the direct effect of sunlight on the skin and the effect of excessive sweating, which is always present in summer on the skin. Okay. So, the direct effect of sun is mainly because of the ultraviolet radiations present in this.
Okay.
The sunlight that is reaching the earth's surface contains various rays from gamma rays, infrared, visible light, then ultraviolet rays, several other rays, of which it is mainly the ultraviolet rays that is having some sort of biological significance on the skin.
Okay.
And this ultraviolet rays itself can be UVA, B or C, of which UVA and B are mainly significant.
Okay. So, exposure to ultraviolet rays can be very harmful for your skin. So, they are the real villains during summer.
We can say like that, because even like when the visible light is very harsh, if the proportion of ultraviolet rays is less, the harmful effect will not be as much as the other case.
Okay. So, how do these ultraviolet rays affect our skin?
Yeah. As I told you, UVA and UVB are mainly implicated. And while these fall onto the skin surface, the outermost layer is called the epidermis, and it contains various cells which absorb these UV rays.
Okay.
And it is mainly the DNA present inside these cells that absorb the UV rays. And under this influence, these DNA undergoes various changes. They form certain new bonds, some existing bonds are broken, and these changes sometimes causes death of the cell.
Okay.
Sometimes causes some other abnormal reactions in the cell. Sometimes even it can lead to a series of other reactions as well.
Okay.
So, all these have its own implications, and these implications can be again two types, which is normally present. Any person who is getting exposed to this sunlight may develop certain things, right? So, that is a normal reaction, and in some cases it is abnormal.
Okay.
It's seen only in some cases.
Okay.
And these are the patients actually who come to us
for
many
treatment.
a time, with various allergic reactions.
Okay. So, you mentioned about some abnormal reactions, which require treatment. Can you please elaborate on what exactly they are?
Yeah. So, before coming to the abnormal, let me just give a brief description of the normal reaction.
Sure.
What all can happen normally? Like the ultraviolet B is mainly involved in this normal reactions. So, after exposure to UVB, there is redness. Redness is the most common effect seen on skin, otherwise called erythema. This is again because of the DNA damage. So, this redness develops after a few hours of exposure and usually subsides without any treatment itself. And sometimes there are pigmentary changes, different types of pigmentary changes, which may be some short-lived pigmentation, moderate duration pigmentation, and some persistent pigmentation, otherwise called tanning. We call sun tan.
Okay.
So, this immediate pigmentation is just because of some reaction occurring within the cell because of the UV rays, and they also resolve within few hours to days, 1 to 5 days they will be gone. Whereas the permanent pigmentation is mainly because of new melanin synthesis. UV rays stimulate the pigment cells to produce new melanin, which is distributed throughout the epidermis, leading to like fresh pigmentation. And this will persist. This will go only after the skin is rejuvenated. Normally, the skin peels off over a time of 1 to 2 months, right? Only following that, this pigmentation will resolve. But anyway, these changes are very commonly seen in almost any individual, though their proportion can vary with the skin type.
And these can fade away with time?
With time, even without treatment.
Without treatment.
Like from 1 to 6, there are different skin types, of which the 1 and 2 skin types are more prone to erythema, redness, that sort of reaction. Whereas the tanning and pigmentation is more commonly seen from 3 to 6 type of skin. And so, after this, I will come to the abnormal types of skin reaction. So, this is quite commonly seen like in every individual, whereas in some patients, they develop intense reaction like redness, itching, scaling, some cases vesicles, blisters.
Is this referred to as sunburn? Is that what you're
no.
talking about? No, that's
No,
different.
That's
Okay.
different.
Okay.
That is actually an intense type of the normal erythema.
Normal erythema. Okay.
This normal erythema, under the influence of like very severe UV rays, it can, like the extent can be from normal redness to thickening to like blistering.
Okay.
That is sunburn.
Okay.
That again, any individual like exposed to that degree of UVB rays will develop sunburn.
Okay.
It's not like for some individual alone.
Okay.
Whereas these patients having this photosensitivity or allergy to sunlight, when they are exposed to sunlight, they develop typical rashes only on the exposed areas.
Okay.
So we diagnose that by the distribution.
Okay.
The rashes will be mainly on the malar area, the forehead, the earlobe, back and sides of neck, the outer aspect of forearm and hands. Like only the exposed areas will be significantly involved.
Okay.
And these reaction can be just normal allergic reaction without any significant cause. Some patients are allergic to sunlight for some reason. Okay, then that is the most common type. 80 to 90% of patients coming with photoallergy will be having this idiopathic type. They are for some reason allergic to sunlight. But the more significant ones are, sometimes a proportion of patients may be having some internal disease. Okay. And that may be making them more photosensitive. Okay. Okay. And many a time they may be unaware of this condition as well. Okay. Like, you might have heard about lupus conditions, certain rheumatoid diseases. All these conditions make the patient's skin more photosensitive. Okay. So that they may come to you with like exaggerated rashes on the photo-exposed area, but they may not respond normally to the medications. Okay. So then we have to suspect, there could be something even deeper.
So, for patients who have these abnormal reactions, like what you mentioned just now, the root cause could be something other internal issues. Yeah. So, what are those internal issues that could lead to this?
Yeah, there are several issues. Of most common ones being, as I explained, these some acquired diseases like lupus erythematosus, sometimes certain hereditary conditions like porphyrias, xeroderma pigmentosa, and certain other existing skin diseases like vitiligo, psoriasis, atopic eczema, etc. Okay. So, in genetic condition means these diseases will be normally diagnosed in the childhood itself. The patient is aware of that condition. Okay. Now they are having some exacerbation and they have come to you. You give the treatment and it's fine. But there are certain other conditions where the patient is unaware of the disease, they are coming with the problem, and it may be after the evaluation you are detecting this problem. Okay. And many a time the management is done by the physician or a rheumatologist, but definitely with the cooperation from the dermatologist. Okay. So, like that it may lead to diagnosis of some deeper underlying serious disease as well. Okay. And pre-existing skin diseases can also make the patient more photosensitive. So, while along with treatment of those conditions, we have to advise them regarding photoprotection as well. Okay. And there is another category of conditions where the patient may be taking some other medications, maybe for some systemic disease, and these medicines or these chemicals make their skin photosensitive.
Okay, so it could be a side effect of the medicine, they're taking for some other ailment that they have.
Yeah. Okay. So, unless we stop those medication, this may not be controlled.
Cured. Okay.
Yeah. So, the patient may be continuously taking photoprotection, the medication, but still the patient is having the problem. Okay. So, we have to deeply go into the history, take the details. Okay. So, they may reveal like, they are on this particular medication, especially chronic medications for diabetes, hypertension, cholesterol, all these can some cases cause photosensitivity. Then along with some other like antibiotics, antipsychotics, all these have this problem. Okay. So, we have to like thoroughly take the detailed history of the patient also before going in directly into the treatment.
And doctor, during summertime, a lot of skin issues crop up. So, how do we tackle those?
Yeah. So, along with these direct sun induced problems, we can have problems due to normal or abnormal sweating as well. Okay. Excessive sweating induced or even normal sweating induced issues. Most common of this is the miliaria, which we commonly call prickly heat. Okay. It is because of the sweat glands being occluded because of some cause, leading into rashes on the body. So, here it could be very mild in the form of some reddish rashes with mild itching, to very severe, where there can be excessive rash, like generalized rashes with excessive itching and other symptoms. So, some soothing treatment should be given. Definitely, they should be given some soothing agents for calming the itching, and they have to be advised regarding like tackling the condition as well. Then, the sweat usually tend to accumulate over the body folds, and this act as a media for various infections, which could be the fungal or bacterial infection. Common one is the pityriasis versicolor, which we see as white or brown spots over the body. The common tinea, like what we call. So, this is normally this fungus is present as a commensal on our skin, but under certain circumstances they become a disease. That is because of the sweat being accumulating on the body, staying on the skin surface for long duration. So, that has to be avoided. Then certain other infections like candidal infections can occur on body folds like the inframammary areas, groin, in between the toes, and those areas may be damaged by the fungus, and they may be super infected by bacteria, which can ascend to other body parts as well and can lead to complications. So, earlier identification of this fungal disease, proper treatment and preventing the complications are important. So, these are the effects of excessive sweating on the skin.
And we keep hearing about how important it is to use sunscreen during summer. So, could you please tell us, for the benefit of the viewers, what are the different types of sunscreens available in the market? And
while we come to the topic of treatment or management of these sun-induced issues, definitely the first option would be like sun protection with sunscreens. So, sunscreens can be broadly classified into organic and inorganic type depending upon their properties, that is how they act. Then depending upon the spectrum of UV rays they cover, they can be again UVA based sunscreen, UVB or combined sunscreen as well. So, organic sunscreens are basically certain chemicals which absorb the UV rays, and after absorbing they undergo certain chemical changes and that lead to the effect on the skin. Whereas these inorganic ones are just opaque substances which are applied on the skin surface which just scatter or reflect the rays. They do not absorb, they do not undergo any reaction, they just reflect or just scatter the solar rays. So, it is often seen that these physical sunscreens are much superior to the, these inorganic sunscreens are superior to the organic sunscreens in terms of efficacy. But the problem is, these being opaque particles, they form a layer, a white layer on the skin surface.
We have seen this on cricket field when cricketers wear a patch of, you see a white patch on their face.
This is
but that's more effective, much more effective than
the invisible type of sunscreen. But because it is not cosmetically acceptable in all cases. So, we may have to go for other options as well. But nowadays, certain modifications like micro, nano particles etc. has been introduced, where these particles like titanium oxide, titanium dioxide, iron oxide, all these are being zinc oxide. These are being made into very tiny minute particles, nanoparticles. So, these are not very easily visible on the skin. And many a time we combine organic and inorganic sunscreens in the same product. So, that it gives definitely a better effect.
That's perfect, I guess.
And also in terms of the rays they cover, UVA, certain chemicals are mainly targeting the UVA rays, some mainly targets the UVB rays, and some are some certain modern new era ones cover both as well.
And we keep seeing SPF on all the sunscreen bottles, So, what does this mean? What is meant by SPF?
SPF is actually just one of the many indicators which give an idea about the efficacy of the product. It's not just the absolute one. It sun protection factor or sunburn protection factor is actually an indication of its efficacy of UVB coverage. Since most of the effects of sunlight is from UVB, it's like UVB coverage that is indicated with the SPF. SPF indicates the proportion of the protection, the level of protection of to UVB offered by this particular product. And depending upon this level, it can be a low SPF, medium SPF to high SPF. like 2 to 15% is low,
Okay.
15 to 30% medium, 30 to 50 is almost high, and nowadays there are very high ones as well,
Okay.
above 50% of SPF.
The 16th branch of Megamart and Macromart supermarkets in Bahrain has opened in Sahla. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. Megamart and Macromart, your favorite shopping destination.
What is the ideal SPF to be used? Is it a general thing for, is it for all skin types, or do you evaluate on the basis of each and every person's
SPF
skin?
is not depending upon the skin type.
Okay.
SPF is mainly, as the name indicates, it's the amount of UVB that is screened by it.
Okay.
So it's mainly for a particular area. Depending upon the location, the proportion of UVB and UVA changes. That is with the latitude, with the altitude, and with various other factors, these proportion may change. So it's depending upon the location we suggest UVB.
Okay.
Then in areas which is very hot, humid, we feel like the UVB is more, there we require a high SPF sunscreen itself.
Okay.
Whereas in temperate or in tropical areas where the heat is low, UVB proportion is low, maybe a medium SPF is enough. Whereas patients having some diseases or on some other medications which can cause photosensitivity, maybe very high SPF may also be required.
Okay. So more than the skin type, it is the climate that determines what is the ideal SPF to be used.
And along with SPF, there are other indicators as well. This SPF is for UVB, right? So for UVA, we have boot star rating and certain other indicators as well.
Okay. And what are the things, factors to be kept in mind while using a sunscreen? Is there a proper way to apply it, and how do we go about it?
Yeah. So just by having a sunscreen in your wardrobe, or just by buying the right sunblock, does not give you adequate protection. There are many things that we have to consider while using sunblock. One thing is the SPF, depending upon your location, whether it is the product with right SPF. Second thing is your skin type. Depending upon the skin type, different preparations are available, like sunscreen for oily skin, sunscreen for sensitive skin, sunscreen for dry skin, like that.
Okay.
So if you're a person with acne prone skin or oily skin, it's better to avoid like very oily preparation of sunscreen, which can like augment acne. Okay, so that your type of skin type, depending upon your skin type, you have to choose the product. Then ideally it is advised that the amount of sunscreen to be applied is 2 gram per centimeter square.
Okay.
So, you know, a face, if you consider around 10 centimeters square, you need up to 20 grams for a single application.
Okay.
And it is advised that it should be reapplied every 2 hours if you are outside in sun.
Okay.
So, many a time it is impracticable.
Yes.
Because, you know, most of the bottles will be 50 or 100 grams. And you are advised to use 20 grams, about half the bottle for a single application.
Single time use.
Any time we don't use that much. It is adequate, or the ideal amount is not being used normally.
Okay.
But that is for the ideal scenario. To get the 50% SPF, you have to use this much. But practically, we can use some other measurements as well. That is teaspoon, a teaspoon measurement.
Okay.
That is half a teaspoon. That is 2.5 to 3 gram for face and forearm. Each 3 gram each for your face and each forearm. Then approximately 1 teaspoon, that is 5 to 6 gram for your legs, back, chest, each legs and for back and for chest. That is an approximate amount that has to be used.
Okay.
And at least every 4 hours sunscreen should be reapplied, because as I mentioned, most of these chemical sunscreens undergo certain changes, degradation, photo degradation following UV exposure.
Okay.
So after a while they become useless.
Okay.
They just a cream on your face.
Okay.
So they have to be reapplied.
And is it necessary to apply sunscreen even when you're staying indoors when it's summertime?
As I told you, it is not the visible light that is responsible for these changes.
Okay.
So if your room is having a window and you don't feel too much light inside, that is, visible light is not that much, but still there can be scattered UV rays.
Okay.
UVB as well as UVA can come inside, scattered rays. And if you're a person having some sort of sensitivity, that is enough.
Okay.
So in that case, you have to use, it's better to use a broad spectrum sunscreen even indoors if you have at least a source of indirect sunlight also
coming in. It's advisable to use sunscreen
indoors
even
as
at
well.
home. Okay. And doctor, we keep hearing about vitamin D deficiency because of lack of sunlight, and as you mentioned, sunscreen is something that protects us from the UV rays. So do you think continued use of sunscreen will lead to some kind of a vitamin D deficiency?
That's actually a topic under controversy.
Okay.
You know, one of the only beneficial effect of direct sun exposure on skin, we can say it's vitamin D synthesis. Vitamin D is synthesized from various precursors, say certain precursor cholesterol lipid molecules in the skin under the influence of UVB rays. Okay, and that is not the final product, it is a precursor only, and afterwards that is being converted into the active form of vitamin D.
Okay.
So, studies have shown that even very minute amount of sun exposure, that is 2 to 3 minutes of sunlight exposure of face, forearm and legs in a summer season, 2 to 3 times in a week is essential during mid-noon, is essential for adequate synthesis of vitamin D. Okay. So, as I mentioned, this SPF is calculated by the ideal usage of sunblock, 2 gram per centimeter square every 2 hours. The ideal usage gives you the 50% or 100% SPF, but many a time what we use is below this ideal level. So, never this normal use of sunscreen is going to obstruct the normal level of vitamin D synthesis in day-to-day life, because it's not enough. This amount of sunblock that we apply is not enough to block it completely.
Okay. And how about using cosmetics during summertime, because obviously there will be a lot of sweating and it can lead to clogged pores. So what is your take on that?
Yeah, so during summer, you should definitely include sunscreen in your routines. Like after a moisturizer, you have to apply a sunblock. And after that, as you have mentioned, the excessive sweating, the different layers of moisturizer, sunblock, and this all can lead to clogging of pores, which can eventually cause other issues of skin, like acne, some cases allergic dermatitis, in some cases some irritations like that.
Okay.
So there is a possibility. So often it is beneficial to reduce the amount of makeup that you use during the summer season.
Okay.
But yeah, that is fine. Usage of makeup is fine, but the amount may be minimized.
Okay. And does diet play a role in your skincare routine?
Yeah. So along with the topical
especially during summertime.
Yes. Along with these topical measures like sun blocks or other sun protection protective accessories like a broad brimmed hat, clothing, proper clothing, all these are like external protection, gives external protection to the skin. But internal factors also do have a role. As I told you, UV rays cause DNA damage, and it is seen that about 80% of these damages are being repaired by your body normally itself. So, we should take some kind of like supplements which will boost this repair reaction, or which will boost your immunity, and in turn these repair processes against the sun damage. Some of these are beta carotenes, vitamin C, vitamin E, flavonoids, green tea extracts, like that. So including these things in your diet, that is mainly the fruits, vegetables and green tea, etc., will definitely help to augment your immunity against the sun damage.
Okay. And what about water intake? Is dehydration a cause for dry skin?
Dehydration and dry skin are entirely two different things.
Okay.
Dry skin is mainly because of the decreased oil content of the skin.
Okay.
It is many a time a genetic problem. Due to some genetic cause, normal lipids and lipid barriers are not being formed on the skin. As a result, a barrier function is impaired and the skin loses moisture faster.
Okay.
Okay. So that is mainly an oil-based problem and mainly genetic. It's a chronic issue. Whereas dehydration is due to the an acute deficiency of water intake. So suddenly, like for a few hours, if the patient is remaining dehydrated, and if it goes beyond a certain limit, that can lead to sudden loss of function of the skin. But that is not the dry skin that we see.
Okay.
Here the skin becomes kind of wrinkled,
Okay.
loses its luster, becomes dull, like that. And once we supplement the water, it comes back to normal.
Okay.
So to test that, we can pinch the skin. So the skin will remain wrinkled for a while.
If it's dehydration.
In
Okay.
dehydration.
Okay.
Even if you leave the pinched area, it will
remains
remain
wrinkled.
wrinkled.
Okay.
That means water is lost,
Okay.
mainly from the subcutaneous tissue.
Okay.
And definitely on the skin surface as well, but mainly in the down part.
Okay.
Whereas in dry skin, the skin texture is normal. The skin, like it goes back to its normal level, but the skin surface looks dry and kind of scaly.
Okay.
So that they are entirely different things, but definitely in summer, because of various other issues, because of the effect of the sunlight, because when these various sun allergies resolve, skin can have dryness.
Okay.
Yeah, so dryness also is an issue in a summer season. So that's why our routine should include a moisturizer, sunblock, moisturizer, sunblock, and a good cleanser.
Okay.
Because once we are back from outside, it's always advisable to wash the skin to get rid of all these like oils that is in the moisturizers, the sunblock, the makeup, whatever you are applying, and the dust and other particles.
Okay.
So that the skin can breathe.
Okay. And how do we tackle the effect of excessive sweating on skin during summertime? Any tips on that?
Yeah. So patients are advised to take at least 2 showers per day.
Okay.
Because if the sweat remains on the skin surface for long, it acts as a media for these organisms to act, to multiply. So that media should be eliminated. So even if you sweat, that is not an issue. It has to be cleaned or cleansed at regular intervals. So at least 12 hourly bath is advised with a mild cleanser followed by a good moisturizer. Then it is preferable to wear cotton clothes or any clothes that can absorb the sweat or moisture, so that they are not allowed to stay in between this cloth as well as the skin and the skin. Sometimes some nylon material, etc., synthetic materials, let the sweat remain there. It does not absorb it. So that can again lead to other infections.
Okay.
And while you are outside, you can use cotton clothes, but a tightly woven cloth is advised. Because even loosely woven clothes can let UV rays through it.
Inside.
So even we are fully covered, if it is like a very thin cloth, you may not get the desirable protection.
Okay.
Okay. Then a thorough use of cleanser, a proper cleanser, especially that containing some kind of antifungal agents, like not the medication as such, certain antifungal things with antifungal properties like sulfur. So that there are certain cleansers available which will help to prevent fungus from forming in the body. For those patients who are at high risk for developing these fungal infections, can use as a prophylaxis these sort of soaps and cleansers.
Okay. So doctor, before we wrap up, can you just explain in a nutshell what should be the ideal skincare routine during summertime?
Yeah, summer being very harsh on the skin, it's always advisable to follow a regular routine. First, you have to be aware of the various effects of the sunlight and what all in the sunlight can cause a problem. You have to be aware of these things and act accordingly. And you have to include a very good moisturizer, a broad spectrum, organic plus inorganic sunblock, and other protective measures like a tightly woven cloth which covers almost all the exposed parts, broad brim hat, good sunglass, all this will give protection. And along with that, you have to ensure that you are taking adequate amount of water and also nutritious food which gives you all the essential supplements, vitamins and antioxidants which will help your body to protect protect you to act against these as well.
Okay. Thank you so much, doctor, for taking the time out to join us and for sharing so much of information on skincare and especially during summertime. So friends, I hope all these tips will come in handy for all of you during summertime. Take care of your skin, be gentle and kind to it, because skin is something that you will be wearing every day for the rest of your lives. Love your body and love yourself. Till we meet again next time, this is Anupama signing off. Stay healthy and stay happy.
The 16th branch of Megamart and Macromart supermarkets in Bahrain has opened in Sahala. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. Megamart and Macromart, your favorite shopping